Does diet really cause acne? The evidence explained. Does chocolate really cause acne? What about milk, protein shakes, or greasy foods? For years people were told diet has nothing to do with acne. But the truth is probably somewhere in the middle. Diet usually isn't the main cause of acne. But in some people, it can definitely make things worse. Acne is complicated. Hormones play a role. Inflammation plays a role. Oil production, blocked pores, bacteria, genetics. So there's rarely one single cause. But modern research does suggest certain foods may influence acne pathways in some patients. The important thing is separating real evidence from internet myths. High sugar and processed foods. The strongest evidence probably involves high glycemic diets. These are foods that spike blood sugar quickly. Things like soft drinks, sweets, white bread. Highly processed carbohydrates. When blood sugar and insulin rise rapidly, it can increase signaling pathways linked to acne. This may increase oil production and inflammation in the skin. Some studies show patients improve when they reduce highly processed high-sugar foods. That doesn't mean everyone needs a strict diet, but it does suggest nutrition matters. Milk and dairy. Dairy is another area with growing evidence. Interestingly, skim milk seems to have the strongest association. The exact reason isn't fully understood. Possible mechanisms include hormonal signaling and IGF-1 stimulation. But this is important. Not everyone with acne needs to stop dairy. Some people notice a major difference. Others notice none at all. Some patients develop acne flares after starting whey protein supplements, often around the jawline, chest, and back. This seems more common in younger gym users. Again, it may relate to insulin and androgen signaling pathways. If acne suddenly worsens after starting whey protein, it's worth considering as a possible trigger. Whey protein. This is something increasingly seen in clinical practice. Chocolate and greasy foods. Chocolate is controversial. The issue may not actually be cocoa itself. It may be the sugar, milk, and processed ingredients that come with it. And despite what many people believe, eating oily food does not directly make your skin produce oil. That's one of the oldest acne myths around. Anti-inflammatory foods. Some evidence suggests anti-inflammatory diets may help support overall skin health. Foods rich in omega-3 may help reduce inflammatory signaling. Examples include salmon, sardines, walnuts, and flaxseed, but diet alone rarely cures moderate or severe acne. Important clinical point. One of the biggest mistakes people make is following extreme internet advice. Cutting out entire food groups, over-restricting diets, or chasing miracle cures online. Acne is multifactorial. Good management may involve proper skincare, medical treatment, hormonal assessment, procedures, and lifestyle optimization. Diet is only one part of the picture. The strongest evidence currently supports high glycemic diets potentially worsening acne, dairy being a possible contributor in some patients, and whey protein triggering acne flares in certain individuals. But responses are highly individual. That's why evidence-based assessment matters more than social media myths. If you're a practitioner, nurse, injector, or skin therapist, comment below with your clinical experience. Have you noticed acne worsening with whey protein or high-sugar diets? And what treatments are working best in your clinic? Subscribe for more evidence-based skin and aesthetic education. To learn more, visit the main ASI website for courses, workshops, and clinical education resources.